Here we go, everyone. The briefing from Austin Public Health about the latest updates on COVID-19 and the ongoing vaccination process is about to get underway. Let's listen in.
And interim Austin Travis County Health Authority, then Janet Pichette, Austin Public Health Chief Epidemiologist, and Cassandra De Leon, APH Assistant Director, Disease Prevention, Health Promotion Division. We will then open it up to our pool reporter, who will ask questions on behalf of the media. Stephanie, over to you.
I'd like to start today by letting everyone know that this is National Public Health Week. At this time every year, we take time to really celebrate the work that Austin Public Health has done. I have to acknowledge the staff here at Austin Public Health and the work that they have done this past year, but that they do year in and year out. Staff have done a yeoman's job in keeping Austin and Travis County safe. If you have access to or know someone that works at the health department on the local level, across the state or the nation, please let them know how much you really appreciate the work that they've done over this year, but just moving forward. My hope is that this has shown a light of how the work of public health is critical to the life of everyone in Austin, Travis County, and across the nation. We are working very hard in our vaccine administration process to ensure that we are watching the data. We are looking at the number of individuals that have received the vaccine in Travis County. As a hub, just a reminder, we are obligated to provide vaccines for individuals across the state of Texas. But one of the things that we must continue to do as Travis County is we are a safety net provider. We must make sure that when we see gaps, we need to make sure that we are working within our organization, but it is essential for us to collaborate with our partners. As we continue to move forward, Austin Public Health will be collaborating with other partners that are providing vaccines in Travis County to ensure that we are providing vaccines in the Eastern Crescent, and we are continuing to reach seniors that are 65 years of age and older and that are homebound. Those are our initiatives as we move forward. We want to make sure that we are reaching herd immunity. With that, I will transition over to Dr. Escott.
Thank you, Stephanie, and I'm going to share my slides with some updated information if you just give me a moment. So we've seen some significant improvements in a couple of measures related to the COVID-19 pandemic here in the Austin MSA. So what I'm showing you here is the hospital length of stay, and this is the amount of time it takes for 95% of people to be discharged from the hospital if they're admitted for COVID-19. You're seeing two different measures here. One in blue is that number prior to March of 2021. The orange is March and April of 2021. And these lines were drawn because what we were seeing is a relative plateau or oscillation of the hospital admission numbers, but a decrease in the overall hospitalization utilization. And we were concerned that this was because the hospital length of stay was decreasing. Well, in fact, we are seeing a significant decrease across age groups in terms of length of stay in hospitals. Now, as you can see, for almost every age group, that 95% number was about 25 to 26 in each of these age categories. And after March, it's been around 15 or 16. And this is in the age of now more and more people getting vaccinated. It's now in the age of having regular availability of monoclonal antibody therapy, for individuals who are at high risk for severe disease, and a number of other factors which are likely contributing to this decrease in the length of stay for hospitalizations. So great progress there, about a 40% reduction across the board in terms of the length of stay for these age groups. In addition to that, we've seen a significant reduction in mortality from COVID-19 for hospitalized individuals. So again, I'm showing you in blue prior to March 2021, and in orange, March and April of 2021. And again, for individuals over the age of 65 or older, about a 63% decrease in that mortality rate. And for individuals aged 50 to 64, about a 44% decrease in mortality rates. So again, you know, this is part of what we expected to see with those therapeutics, with the significant introduction of vaccines in our community, that it was going to impact the severity, in particular the mortality associated with COVID-19, which is what the studies for both of those things told us that we should expect. Having said that, we've got more work to do. We saw an update from the UT Modeling Consortium this morning, which shows some concern that we have increasing chances that the epidemic is growing in Travis County. We're seeing plateauing of the projections for hospital admissions, ICU admissions, and hospital utilization. And as of today, entry into stage 2 is off of the projections through the first week of May. So there's no longer a projection that gives us a path to stage 2 at this stage. It means that we have to work harder to continue those protections, the masking, the distancing, the hand hygiene, staying home when we're sick, getting tested, and isolating from other individuals if we have any of the symptoms of COVID-19. And we've got to work on getting more vaccines out. We've got to ensure that everybody has access, and we're certainly excited that we've been able to drop that age requirement in Travis County for vaccines. But we need to ensure that our friends, our neighbors, people we go to church with or work with, know the facts about the vaccine so that we can ensure that we can reach herd immunity by the end of May. With that, I will turn it over to Janet Pichette.
Good morning, everyone. As Dr. Escott mentioned, we are seeing numbers that have been fairly stable over the last few weeks as far as newly reported cases. Roughly, we're seeing about 100 new cases per day on average. But, again, we remain cautious and we are continuing. All the epidemiologists here at Austin Public Health have been monitoring the trends to determine whether or not we are going to be seeing surges. We're monitoring the surge trends throughout the United States and worldwide because we did happen to see similar trends surging last year at this time. So we want to make sure that we stay in this relatively low state. We want to continue to monitor because we see variants that are circulating in our community. We want to see what type of impact that's going to have on our community in general. So it's always our job as epidemiologists to monitor those trends and patterns of disease just to make sure we don't have a recurrence of what happened last year, a spike in cases. We're also seeing an uptick now in some school-related clusters. Many of these are associated with school athletics, and this is similar to a trend that we're seeing nationwide. And so it's a very good reminder that while transmission risks are minimizing for many of those fully vaccinated individuals and older adults, the risk still remains for those who are children and young adults. And so we need to continue to be cautious and use those prevention measures to limit disease transmission risks in the community. And with that, I'll turn it over to Cassie DeLeon.
Thank you, Janet. And good morning. We are excited to talk about, where we are in this phase of providing vaccines. We know that next week, Austin Public Health will be able to expand our eligible population with the clinics that we're providing to anyone 18 and older. And so we want to make sure to encourage anyone and everyone who has access to vaccine to get that vaccine. It is the opportunity to protect yourself, protect your loved ones, protect your friends, and protect the community. We know that with every person that receives a vaccine, that continues to move us along that path of herd immunity, as Stephanie and Dr. Escott both have been speaking to. And so it's very important that we continue to see the population expand that can get vaccinated, and see additional folks take that opportunity. And we also want to encourage, as Stephanie talked about, we're maintaining all of those interventions for those particularly high-risk populations. And so as we expand to provide vaccine to everyone 18 and older, we also are really pushing hard to make sure those that are 65 and older, those that have been disproportionately affected by COVID-19, that there's specific focused outreach to those populations so that we can ensure everyone across the community has those protections in place. And again, as vaccine becomes more and more available, hopefully folks will be able to get that vaccine, have limited barriers to it, and we can get back to life as we knew before pandemic. And with that, I'll open us up for questions.
Thank you, Cassandra. Now we will open it up to our pool reporter, Beth Sullivan from the Austin Chronicle. Beth?
Good morning, everybody, and thank you for being with us today. My first question is from the Austin Chronicle. It's for Director Stephanie Hayden Howard. Can you please provide an update on when APH expects to start publishing the data and demographics of those getting vaccinated at the Circuit of the Americas site on APH's vaccine dashboard?
We are receiving that data this week, and the plan is it should be on our website on next week. Just keep in mind that the data does have a week lag. So the information that you would see next week would be for the previous week. In addition to that, on Tuesday, the plan is for us to bring that information to Council and Commissioners Court so we can walk through that data specifically from CODA, and then kind of show the comparison of the existing data in the website, on the website.
Next question is from CBS Austin. Why did APH decide to expand vaccine eligibility to ages 18 and up so quickly after expanding to ages 14 and up, especially since appointment slots are once again consistently filling quickly?
One of the things that we continue to monitor is we monitor how quickly our appointments are filled. And we've done that during this entire time. If we have a large demand of folks that are making a request and we have a smaller window of folks that are eligible and those appointments go very quickly within a couple of hours, then we want to keep the eligibility the same. The state of Texas has allowed us to continue to prioritize folks that fit into the category of 1A, 1B, and 1C, and especially focus on individuals that are 70 years of age and older. And so in our observations, we have noticed that it is taking a shorter amount of time. In addition to that, we have had conversations with providers across Travis County, but also in our neighboring counties. And we know that others are receiving vaccines more widely available. And so with the knowledge of looking at how our appointments are filling up, as well as the knowledge of the other providers that are receiving vaccine, we decided to make that change. that change will be effective on Monday when we release our appointments.
I'll just also add, it's important for us now that transmission is low or has stabilized for us to ensure that younger people, ensure that folks who are frontline workers, our restaurant and bar workers, our construction workers, our public-facing workers who have to go back to work now, to ensure that they have adequate access because those individuals are the ones who are at highest risk for transmitting disease and at highest risk for being exposed because of the nature of their work. So opening up the window will help us to ensure that we can get to those frontline workers more efficiently and hopefully stem the transmission of COVID-19, particularly with the growing concerns regarding the variants that we're seeing.
The next question is from Community Impact. APH has asked portal users to indicate whether they've been vaccinated elsewhere. Are people doing that? What is your confidence level that the number of people online at APH is accurate?
Well, we've certainly seen thousands of people go in and revise their profile, which helps us get an accurate count of how many people are actually waiting for a vaccine at APH. And we're asking folks to, continuously do that. If they go to Walgreens or CVS or HEB and get a vaccine, please remember to go back and take your name off of the list for APH. Similarly, if they're vaccinated at APH and they're on a list of other places, to go back and update those requests so that we as a community know how many people are waiting for the vaccine and will help us be more efficient in the delivery of vaccine. In addition to those revisions, we've seen thousands and thousands of additional folks sign up to get the vaccine. So, we still have many more folks who want the vaccine than we have vaccine, but we're certainly hopeful that, we're going to meet the goal of by the end of April or end of May, having a vaccine available for everybody in this community through APH as well as the other providers in the community.
I think one other thing I'd like to add is that with the new folks that are registering on the site, when the other ones go out and close out their accounts, we can be more targeted in our communications. We're, have the ability to send text messages, emails, as well as we have a team that are making outbound calls. And so we really want to be as efficient and effective in targeting individuals that actively would like to have the vaccine. And so for us, it's such a collaborative effort. And so it definitely does help us when individuals do go in and close out those accounts. And even if they've had the second vaccine at another provider, that is also helpful for us as well, because we do have the ability to transition that second dose to a first dose or allow it added to someone else that may be reaching out to us that needs the second dose and received it from somewhere else. So it's helpful all the way around when individuals are able to do that with those accounts.
This question is from KXAN. Has APH received any updates on when to expect vaccination for kids? Will APH help facilitate those, or will that be through local pediatricians?
So we are, as well as the rest of the nation, watching intently the clinical trials that we know that the vaccine manufacturers are working toward for expanding vaccine for children, appropriate for children. Pfizer, of course, is available for those who are 16 and older. And we encourage anyone who's eligible to get the vaccine. That being said, we are a vaccine for children provider, and we also work with other vaccine for children provider that network within our community, as well as pediatricians and other healthcare across the healthcare system to work to roll out all vaccines for children. And so we would play the role that we continue to play in the COVID vaccine space, but then also continue to work as we do with providing normal childhood vaccinations, as COVID would come on and be part of the vaccine, recommended vaccines for children, we would work to both promote the vaccine to the public and provide a consistent message about the vaccine and the safety of vaccine, and encouraging parents to have their child vaccinated, as well as work with providers to ensure that they have the supply and capacity to vaccinate children, and then also play a role in being a vaccinator as well. So we have lots of different avenues that we already work in the vaccine for children space that we would continue to do. And then also noting that our role as a public health entity in working to vaccinate our whole population with COVID, we would continue to work through that. So there's a lot of different ways that we're working on that, and we're starting to have those conversations with providers about anticipating how would this work with within their capacity to provide vaccines. Are they considering how they would need, if they're not currently a provider, to encourage them to become a provider in anticipation of that vaccine being available for that broader population, to include children. In addition, we are really focusing to make sure, and we have been focused on those settings that include teachers and early childhood providers, that they are receiving vaccines. So it offers some of that protection to children and helps to mitigate spread in those specific settings. So again, as vaccine becomes available, we want all adults to get vaccinated, because that continues to protect everyone else in the community. And if vaccine is available, and once it comes online for children, we will work to continue to ensure that those that are eligible have access.
Let me just also add, you know, it's a mistake for our school systems, for other settings where, you know, children are the primary client or customer, places like camps, in those sort of settings. It's a mistake for them to start to remove the protections, to start to remove the masking. Again, the population of teenagers and younger children are almost completely unvaccinated, which means that their risk is still there. As the community risk goes down, as adults are vaccinated, and, you know, we start to relax things at some stage in terms of the adult population, we have to maintain the vigilance for our children in our schools and our summer camps until we have vaccines available for them. Because if we don't, we are going to see significant increases in transmission in those age groups. This is exactly what Israel saw. They had 60% of their adult population vaccinated. You know, relaxation was happening, and they saw a surge in children and young adults. A significant increase in hospitalizations in individuals less than 19 years old. The risk for children is not going to go away. And we need to avoid, particularly until the end of the school year, increasing the risk by removing mask mandates. So please keep that vigilance for our young people so that we can decrease transmission, and certainly the concerning increase in rates of some of the inflammatory reactions that children are seeing.
This question is from Co-op Radio. You have consistently separated sports from school, and data now supports your concerns. What level of vaccination in students do you see is needed to safely allow school sports in the fall?
Well, I'll tell you that our expectation is that, probably in the next month to 2 months, we're going to see a vaccine approved for individuals 12 to 16 years old. So that's going to fill the gap of middle school and high school. And that's primarily where we're seeing the extracurricular activities. In my conversations with the Travis County superintendents, I recommended they focus particularly on those student athletes and ensuring that over the summer, as soon as vaccine is available, that they are actively encouraging and providing opportunities for their student athletes to be vaccinated, so that by the time fall sports start in late summer, that we are going to significantly decrease the risk of transmission. We've been saying this for a year, that these are going to be the vulnerable areas of the school system, and we continue to see that locally and nationwide. So again, we also have to maintain those protections, the masking and distancing, until we reach that stage. But it's probably going to be 70, 80% of those student athletes that need to be vaccinated before we have effective immunity within those groups.
And I would just like to add that, we are also monitoring very closely the variants that are circulating within the community, because this could also have an impact on those younger populations. But again, as Dr. Escott mentioned, this is just a very strong reminder that we still need to be vigilant in those preventative measures that keep transmission risks low, and that's wearing your mask and washing your hands and staying home when you're sick. I think younger kids and young adults tend to be a little more resilient, and they can do more when they are sick, especially if they have mild disease. So another thing that we're seeing right now is that a lot of cases that we're investigating, many of them are saying that they think they thought they had seasonal allergy, but for some reason they did go on to get tested, and it's actually been COVID. So while you may have mild symptoms, there is a possibility that it could be COVID versus allergies, I should say.
This question is from the Austin American Statesman. Are health leaders concerned that Travis County's oldest and most vulnerable residents will be delayed in receiving the coronavirus vaccines as young, more tech-savvy residents are signing on to secure a dose?
I'll just say that if you are a resident of Travis County and are aware of somebody who is elderly, who has not been vaccinated, especially if they're 70 and over, or have had challenges getting a vaccine, they need to assist that person in reaching out to 311, and we will reach out to them and try to set a vaccination up for them.
And just to add in, we know that having the mass site, vaccine sites, and the online portal isn't for everyone. And that is definitely something we are working through with Austin Public Health. As Janet mentioned, calling 311. If you're having any struggle getting a vaccine, you can contact that number, and we'll get back with you on how we can help you navigate to get an appointment. In addition to that, we have specific focused outreach that we're doing for older adult populations, including partnerships with Meals on Wheels to do homebound vaccines, targeting and focusing into older adult living facilities, really looking to see wherever there is a barrier, trying to allay that barrier and make sure that individuals have the opportunity to get vaccine, and really looking now to find where people are at and taking the vaccine to them. So we hope that multiple strategies are the answer to getting to anyone who needs a vaccine or anyone who's had barriers. But again, just to reiterate, if there is anyone who is seeking a vaccine and is having difficulty, contact 311. We will work to reach back out and ensure that you're able to schedule an appointment.
And one of the things to keep in mind is that we do watch the data. We are monitoring the data. We know that 45% of Travis County residents that are 80 years of age and older are fully vaccinated. We also know that at least 68% of individuals that are 65 years of age and older have received their first vaccine. So we are continuing to monitor the data and continuing to collaborate with individuals, because what we are finding is that when we're working with the nonprofit agencies, or when we're having events like we're having today, there may be information that we share that then individuals will call 311 and they will be referred to our team, and our team will call them and they will schedule an appointment with them. We've been able to really work very closely with, for example, Driver Senior. And so they are able to work with us, and we get folks scheduled, and they're able to drive individuals there. In addition to that, working with Capital Metro on transportation. But we are definitely keeping our eyes on the data for individuals that are 65 years of age and older. We will continue to prioritize and do everything we can do. If they are not able to get on our system and secure an appointment, also just reminding folks, call 311 and they will get a message over to us. They also have the ability to set up an account. So that is the other thing that 311 is helping Austin Public Health with as well.
This question is from the Austin Chronicle. APH's mobile vaccine program so far has focused on vaccinating those who are already connected to or receiving services from a partnering organization. What are the specific plans for APH to expand the MVP outside of partnerships to something like pop-up vaccine clinics where any eligible resident could get vaccinated?
We have currently completed a few pilot vaccine locations with partners. This past Saturday, we were at St. James providing a drive-through vaccine program for folks that attended, any one of those congregations. There were about 6 congregations that referred clients over. In addition to that, partnering at Sacred Heart to be able to provide those vaccines there as well. And so as we do the pilots, our staff will have what we're calling a debriefing, where we look at what works and what did not work, and then go back out and schedule other appointments. In addition to that, we are working with several of our partners to basically put together a map that will show where we will be, including with them as well, to show where we will be providing these additional pop-up locations. And so we're definitely doing more of that. Lastly, we are also asking folks if they know of an individual that is homebound, that does not have, access to and are not working with any agency. We are asking them to call 311. They will give our equity team that information, and our team will give them a call, and our mobile vaccine program will go out and provide their vaccine to them. Lastly, we are working in kind of several locations. We are partnering with the Housing Authority to be able to provide vaccines there. And so we are moving our mobile team around, and that team is working collaboratively with entities to be in a space where we can provide that vaccine to folks that live in that community.
This question is from CBS Austin. How will reduced shipments from Johnson & Johnson impact both APH and other vaccine providers? Should the Austin area expect reduced appointment availability because of J&J manufacturing issues?
So want to reiterate, the majority of the vaccine that Austin Public Health has been providing has been Moderna vaccine. And we continue to receive the same allocation of Moderna. And so we don't anticipate, as long as that shipment continues to arrive, and we've not had any indication we wouldn't continue to get the same allocation week over week, that the appointments that we are scheduling would be impacted. The Johnson & Johnson availability is important to expand vaccine availability across the city, and we have seen, additional providers be able to come online and provide that vaccine, and it is one dose, and so it really does help to expand the ability to vaccinate many more people and have someone fully vaccinated with just one dose. So it is that there is a concern that the availability with additional providers may be affected. However, with Austin Public Health, the vaccines that we have been receiving for the most part are Moderna, and the appointments that we are scheduling through our online portal have all been Moderna vaccine.
KXAN asks, has there been any let-up in demand for vaccines in Travis County? How realistic is it to get 70 to 80% of the population vaccinated soon?
Well, I'll start by saying, some of the timeline on reaching that herd immunity depends upon, the vaccine availability, but also people's willingness to get the vaccine. And we've been talking about for months now, anticipating that we're going to see a large influx of vaccines, of people wanting the vaccines, and then we'd have a rapid increase in the vaccination rate, but a concern that, we plateau and that getting the last, 20 or 30% was going to be a lot more challenging than getting the first, 50 or 60%. So that's what we're expecting now. We're expecting that the number of folks who are excited to get the vaccine are going to start to decrease as they get vaccinated. Then we're going to enter that phase of folks who want to get the vaccine but don't want to travel very far, or may have some barriers, that we're going to have to start moving efforts more closer to home for them, or closer to work for them. And then we're going to enter the phase where we've got folks who have some concerns or some hesitancy that we're going to have to actively engage. And then finally, of course, we're going to have the folks who are not interested in the vaccine that we're going to have to work with through lots of community partners to encourage them to get the vaccine. So there are going to be many phases of this strategy, and it's going to take time to get to herd immunity. But part of that is people in our community understanding the facts and having an avenue to have their questions answered so that we can resolve those issues and get folks vaccinated. I think it's unquestionable at this stage that the risks of COVID-19 far outweigh the risks of the vaccine. This vaccine has shown to be very safe and extremely effective. I think the best example of that for us is our nursing homes and assisted living facilities. We've had a 98% reduction in cases, 98% reduction since February the 2nd. So it's taken a very short period of time to see a dramatic improvement in those facilities that are at high risk for transmission and outbreaks. So if we can get to the levels of vaccination in our community that we're seeing in nursing homes and long-term care facilities, then we'll count that as a success, and it will also hasten our ability to get back to normal for the rest of the community.
The next question is from Co-op Radio. As a fully vaccinated member of the group phase 1B, what do I have to fear from the low national and global vaccination percentages, as well as the rise of more virulent variants it is enabling?
You're muted.
I wasn't saying anything important. So, we certainly see that question a lot. We're seeing it from employers a lot. How does, that vaccination status change? What are the vulnerabilities? And the answer is, the vaccines, particularly Moderna and Pfizer, have shown in real life to be about 90% effective at preventing transmission of disease, even higher when we talk about severe disease and death from COVID-19. But that's with the current strains that we have out there. There is concern that as the variants increase, particularly the Brazilian, South African variants, as well as the potential for emergence of new variants, that new variants may be more successful at evading protections that the vaccines currently provide. Now, there's still good evidence that it can still help prevent the severity of disease and help to mitigate the risk of death. But this is one of the reasons why we need to work quickly to get people vaccinated across the globe at the same time that we are maintaining vigilance through those protective measures. If we just move to vaccines and hope that we can beat the race to a new variant, we're in for a harsh reality. So I think we've got to do both at the same time. We've got to resist the urge to take the masks off and go back to normal too soon, because what we're likely to see is that this will be a continuous process, potentially for a very long period of time or forever, as we have experienced with flu. Now is the chance for us to knock out COVID-19, but it's going to take a global effort and that maintenance of vigilance and protections and vigilance and getting folks vaccinated in order for us to do that.
And as Dr. Escott stated, it's really going to be important for you as a fully vaccinated person to continue to wear your mask, wash your face, wash your hands, watch your distance. And if you're feeling ill, you should take a test and stay home. Those things are important. We have used them. They've been tried and true before we had vaccine on the scene. And so we've got to continue to do those practices to just keep us all healthy, and just kind of continue to monitor your behavior. Whatever you've done thus far to keep you safe, continue to do those things to keep you safe. We're not asking folks not to live their lives, but we are asking you to continue those preventive non-pharmaceutical methods that have worked for you.
And I'll just add that, the Austin Public Health workforce, especially the epidemiologists here in Austin, are working very closely to continue to monitor these variants. And we're also working closely on looking at breakthrough disease. So what are those things that we're seeing as a result of people who've been fully vaccinated but then develop illness? We're trying to glean any type of information we can from breakthroughs and reinfections of disease to see, is it related to a variant, or is it related to some sort of travel history or whatever? So we continue to look at that information. It helps feed our knowledge database as far as how we respond to clusters and outbreaks. But as both Dr. Escott and Director Hayden Howard had said, the best method is to make sure that we are protecting ourselves and our loved ones from any exposure. And the best way to do that is to limit the disease transmission risk that you may be placed in front of you.
This is the final question, and it's from the Austin American-Statesman. The 7-day moving average for new hospitalizations in Austin Travis County appears to be increasing at a slow rate. What is likely the cause of the upward trend, and are health leaders concerned by this slight increase?
I'm happy to take that one. The hospital numbers aren't increasing, or it's not clear that they're increasing yet. What we have seen over the past 3 weeks is certainly oscillation. So we've seen 2-3 days of going up and 2 or 3 days of going down. The admissions to the hospital have been oscillating in a tight range between 16 and 20 for 3 weeks now. We certainly have seen a flattening of the number of individuals hospitalized, flattening of the number of individuals in the ICU and flattening of individuals needing a ventilator. So those are concerning, particularly since the projections from UT indicated this flattening prior to an increase. So we are concerned about it. We're concerned that the projections that UT updated today indicate an increasing risk that the epidemic is growing. A reproductive number for the virus, which is getting closer to 1, which is that threshold for a growing epidemic. And again, now is the time to urge that caution. I know it's getting warm outside, and we're making great progress in getting people vaccinated. We're seeing decreases in mortality and length of stay. Those are all positive things, but it's not time to give up the protections yet. And again, if we aren't vigilant in April, we're going to pay for it in May. And we're going to pay for it when it's time for end-of-year celebrations and proms and graduations. So we just have to continue the mask and continue those protections a little while longer. I think if we can do that, May and certainly June are going to look a lot better. Summer's going to look a lot better. But we're also going to have to realize that some of those protections, particularly for young people, when we think about summer camps and similar activities, those protections are going to have to continue because that group is not going to be effectively vaccinated until at least the end of the summer or early fall.
Thank you, Dr. Escott. At this time, we will now move into our closing remarks. Director Stephanie Hayden Howard, over to you.
Thank you. Just a reminder that this is National Public Health Week. My hope is that if you know someone that works for a public health department locally, that you will let them know that you really appreciate all the work that they've done. One of the things that we continue to make sure that we develop plans for and move forward with implementation is making sure that we are providing vaccines to individuals that are 65 years of age and older and to people of color. We want to make sure that if we've identified an area in our community, it's important for us to be in that space. We want to make sure that individuals are able to go to a site that's very convenient for them, where there's not a question about transportation or ability to access the vaccines. We will continue to do that. We will continue to provide outreach as well as work with our partners to do outreach in those areas and to educate individuals that may have questions about the vaccines. Because we know as we continue to provide vaccines in our community, we may get to a point where individuals are not sure that they want the vaccine. So those are some of the efforts that we are doing now to make sure that those individuals are willing to receive the vaccine, because our goal is to get to herd immunity. But even with herd immunity, we cannot emphasize the importance of continuing to wear your mask and those non-pharmaceutical methods that have worked so well for us over the last year. With that, I'll transition to Dr. Escott. Thank you.
Again, we're seeing some good results in terms of the decrease in the hospital length of stay, decrease in mortality from COVID-19. Thanks to the efforts in vaccinating folks and in the state's support of our regional infusion center to provide monoclonal antibodies to individuals at high risk for severe disease. Those things are working, but we have to continue the masking. We have to continue the distancing. We have to continue the hand hygiene. We have to continue to test individuals who have any symptoms of COVID-19 so that we can drive down transmission. Masking is still the law in Travis County and the city of Austin, so please wear your mask.
And I'll just add, the Austin Public Health epidemiology staff and other public health workforce is working very hard to continue to protect this community from COVID-19. And one of the ways in which we're doing that, not only through vaccine distribution, but we are monitoring clusters and outbreaks. We're monitoring breakthrough cases and reinfections to make sure that we fully understand what exposure risks are causing the disease to prevail in some cases. So we just want to make sure that you understand that we're working hard for you and for the protection of this community. Again, until we reach that level of herd immunity, we need to continue to be very vigilant in our prevention measures to make sure that we are protecting those who may be at risk or continue to be at risk, but also a reminder that those individuals who have not been vaccinated or who are not eligible to be vaccinated still present a risk of disease transmission to the population. So again, those things can be that risk can be eliminated by following prevention measures such as masking, social distancing, making sure you use proper hand hygiene, and if you are sick, especially during the seasonal allergy season, consider getting tested to determine if you have COVID so that you can then isolate yourself and protect those around you. With that, I'll turn it over to Cassie.
Thank you, Janet. And to close out, just to reiterate that if you are looking for a vaccine, you know you're eligible, and again, Austin Public Health and many, many other providers across the county are allowing anyone 18 and older, and in some places where they're offering the Pfizer vaccine, 16 and older, we encourage you to try to get the vaccine. We also want to make sure that folks who may think that there are barriers, like if they don't have insurance, may not be able to pay, think that they may have to present an ID. If you're accessing Austin Public Health, none of those are barriers. So you can know that if you are concerned about those things, those are not barriers to getting vaccine. Don't let that discourage you from seeking vaccine and reaching out to any provider, and in particular to Austin Public Health. We want to make sure that everyone knows that regardless of your ability to pay, regardless of your insurance status, you can get the vaccine. And if you're having that difficulty registering or knowing kind of where you should get vaccine, contact 311. That is a resource that's available for you and can help you navigate that system. And if you are in between that 28 to 42nd day after getting the Moderna vaccine, you are eligible to go back and get your vaccine. You should have an appointment. If you haven't received your appointment, call 311 as well to verify that you have an appointment, and we will provide you with tools on how to get the appointment. And also check your account. Make sure that you, when you look at your account, to see if you've had an appointment. And again, reach out to 311 if you've missed your appointment or if you haven't been scheduled, and we can assist you in getting that second dose. And not just that, Austin Public Health continues to provide PPE to the public, and testing to the public. So if you're worried about, maybe you don't have any additional masks around, or you need to get that for your family, those resources are still available in the community. If you're looking for a test, there are a lot of resources for testing. So don't let access be a barrier. There's a lot of opportunities out there for individuals to get that. And again, as Stephanie mentioned, it is Austin Public Health Week. And all of us can be ambassadors for public health. We all have a role in protecting each other and protecting our families, protecting this community, because we all know what to do. We all have access to the tools, and we can stop the spread of this pandemic and get us back into the Austin and Travis County that we know and love, and back into our normal, regular lives. So again, be vigilant, take care of each other, and we can stop the spread of this disease. Thank you.
That concludes our media availability for today. Thank you to APH Director Stephanie Hayden Howard, Dr. Mark Escott, Chief Epidemiologist Janet Pichette, Cassandra De Leon, APH Assistant Director, D's Prevention Health Promotion Division, and our pool reporter, Beth Sullivan from the Austin Chronicle. Thanks for joining us and have a safe weekend.
Will Dupree, still here in the KXAN live studio. Thank you all for sticking with us through this stream that involved a briefing from Austin Public Health. They've done this for the past few months, doing a weekly update on COVID-19, the vaccination process, and sharing other information. A big headline out today is that Austin Public Health will open vaccine appointments for that COVID-19 shot to all adults 18 and older on Monday. And why they actually did this, I want to reiterate some of the points they made. Stephanie Hayden Howard, the director for APH, said this is because they're monitoring how quickly appointments are being filled at this time and also having conversations with other providers to try to get on the same page as some of them. So that really influenced the decision to expand that eligibility. Also, Dr. Escott pointed out that they wanted to ensure that younger people and frontline workers have more access to receive that COVID-19 vaccine because they are at higher risk, he said, of transmitting disease and being exposed to it because of the nature of their work, having that public face-to-face interaction in some cases. So just wanted to point out those things. Additionally, Dr. Escott did share some encouraging numbers in that there has been a decrease in the hospital length of stay for people, particularly in those older age groups, and also seen a significant decrease in people dying in the hospital after contracting COVID-19. However, he said, quote, "We've got more work to do." He pointed out that there has been a new modeling from the University of Texas here at Austin to see what the situation could become in the future. And he said, quote, "There is an increasing chances the epidemic is growing in Travis County." And that's because there's been a plateau in the projections for hospitalizations and ICU admissions. And he is saying that at this point, it does not look like Austin will be able to go into stage 2 of its risk-based guidelines by May. Then he urged people to continue to do those protections like wear your mask, wash your hands, watch your distance, stay home if you're sick, get tested if you experience any symptoms for COVID-19, and while you're waiting for those results, to stay at home if possible. Additionally, Janet Pichette, the chief epidemiologist for Austin Public Health, did say that her group of staff members is seeing an uptick in school-related clusters, particularly those associated with school athletics, again, urging people to be careful and cautious in that environment. We will have an update and a breakdown of all the things that were discussed today during this briefing from Austin Public Health. That'll be over on our website, kxan.com, and the KXAN News app. Please download that if you've not done so already onto your smartphone. I'm Will Dupree, once again here in the KXAN live studio. Thank you all for watching. We appreciate that. We'll see you back here another time. Please, everyone, stay safe, take care, and be healthy.